Well, hello. Thank you, Pat, for being here today. I'm very appreciative. So we're going to talk for a few minutes about some background and how you've done with the TMS treatment. But first, let me ask you, how long have you had depression?
Probably since my teens was the most severe.
And you've had it pretty much on and off most of your life since a teenager.
Yes. I've been treated since I was probably 17, 18.
And you've been treated with many antidepressants in the past.
Yes, many.
And I know you've been under my care for many years too. And I've seen some successes with you. But I'm glad that now we have another level of wellness, which is why I'm interviewing you today. So why don't you tell me where you were at with medications, the best we did with medications, and then how you found out about TMS?
The medications helped a lot, and it kind of brought me out a little bit, but it didn't quite take me all the way. I still had a lot of anxiety and a lot of just feeling really sad all the time.
So let's now look at your experience. So how was the treatment? How quickly did you notice the benefit? Have you had any side effects?
I was a little nervous at first, I think because it was so new, and I felt like when I came in, though, you made me so relaxed and comfortable. I think I probably noticed the difference right away the first day. I think the first thing that went, I was absolutely shocked that I didn't feel so anxious when I drove home. And I think that taking away the anxiety first just really made a big difference. Continuous uphill. Every day got better. In fact, after the first week, you had told me that, oh, you'll feel even better. And I was feeling so relaxed then without the anxiety that I thought, how could I feel better? And it's been amazing because I really have felt much better.
When was your last treatment? It's been a while now, right?
Like May or April or May.
Okay, so basically it's been about 3-4 months.
Mm-hmm.
This is after the treatment, and the progress continues to build on itself. So tell me what your life is like now. So like, your whole life you've had depression and you've had ups and downs. Your wellness now, how is it different from any wellness you had with medications?
I felt like I could function all right with the medication, but I still had to try and avoid situations and things like that because it would make me too anxious, or I would get too teary-eyed and that kind of thing. And now I look forward to getting up. I'm excited about what I'm going to be doing that day, and I have so many more options because I don't have that anxiety. And I'm finding that, driving, working is just so much more pleasant, and I just have a long list every weekend of things that I could do that I feel like doing, whereas before I didn't go anywhere.
Absolutely. Would it be fair to say that in the past, when you overcame depression with medications, you were satisfied with surviving with minimum expectation, but you really didn't challenge yourself to do things that you were afraid or avoiding? You continued to be walking on eggshells in a way?
Definitely.
And now that you have more confidence in your wellness, you're doing things that you thought you were not able to do, or?
Things I thought I'd never be able to do again. And I would say probably I'm feeling, this is probably the best I've felt since I was 12 years old.
Oh, that's wonderful. So what advice would you give patients who are watching you and who have depression? What message do you want to tell people about your experience and what they should do?
That there's hope, that there is something better out there, and that you don't have to settle for being just 3/4 happy, that you really can find happiness in when you go through a treatment like this that makes you feel so much better.
One last question would be, have you had any side effects or any problems with the medication?
No.
Nothing?
No. What the nice thing about it is that you don't feel any side effects when you have the treatment. In fact, when you walk out the door, you feel better instantly, and you don't have to worry about having any side effects like the medication. And I found that this summer, because I wasn't taking so much medication, It's the first time I've ever had to work without a fan or not feeling fatigued or anything.
So that's another good point, Pat, which is sometimes as good as the medications are, people learn to live with some side effects.
Mm-hmm.
Being able to reduce or in some cases stop antidepressant if the treatment is good by itself is remarkable. I had a patient who thought he was coming down with dementia because his memory was not good. Now his memory is better than it was when he was 20 because it was the side effect of the medications.
Yeah.
So
yeah.
I'm glad that you can do well with less or any side effects pretty much.
Right, yeah, the fatigue is a lot less, the sensitivity to heat.
Well, welcome to the new world,
Yeah.
which is becoming very much your world. Is there any last thing you want to say to me or to the people watching this?
If you have the opportunity to do this, definitely do it. It makes a big difference in your life, and I know that you'll appreciate it, and it's fantastic. Even if you are a little afraid to try it at first, it's well worth it, and I thank you. You've made you've worked very hard for years and years to try and make me feel better, and I really appreciate the opportunity to be able to try this new treatment.
Well, thank you, and I want to thank you for being my patient because my intention to make you well has always been there, but as a doctor, I am delighted that we have a new approach that has good results as we have with the TMS. So good luck and thank you so much. Have a great day.
Thank you.
All right.
Thanks.